Do you ever get neck pain that starts in your neck and travels into your shoulder, your arm, and even into your fingers? Maybe you've had tingling, burning, numbness, or tightness, or that strange pulling sensation when you move your neck. Sometimes we find ourselves in a situation where we feel like the muscles are the root of the problem and we're doing lots of stretches and exercises, but the pulling and the pain is just not getting better. The reason that can happen is that sometimes the origin of the issue is actually the nerves are irritated. And the good news for that is that there are several safe nerve flossing techniques that you can utilize to help those nerves and reduce your pain. Today I'm going to show you what nerve flossing is, why it can help, and several safe ways that you can nerve floss different nerves in your neck and arm to relieve pain. Let's do this. So what is nerve flossing? You have many nerves that run all throughout your body, delivering vital information from your brain to your body tissues in order for those tissues to function and for your body to heal properly. These nerves that run throughout your body need to glide smoothly between the different tissues of your body. But unfortunately, poor posture, prolonged sitting, desk work, cell phone use, inflammation caused by poor diets, stress, muscle tension, arthritis, disc irritation, and repetitive strain can make nerves more sensitive and irritated. And that's where nerve flossing comes in. Nerve flossing, also known as nerve gliding, is a gentle movement technique that reduces irritation and improves mobility around the nerves. Think of nerve flossing as gently mobilizing the nerve rather than aggressively stretching it. Before we start though, this is very important. Nerve flossing should be gentle. You will most likely experience some mild pulling or tension, but I do not want you to force through sharp pain, intense tingling, or worsening symptoms. And if you have worsening symptoms, I would recommend getting properly assessed. So why do people get these symptoms? The most common cause is forward head posture. With the overuse of computers and cell phones, our head tends to drift forward, which changes the mechanics of our neck, shoulder, and upper back area. So to relieve the pain, people will start stretching, and they'll stretch harder over time, but what the nerve actually needs is just gentle movement, and that's where nerve flossing comes in. So let's not waste any more time. First, I'm going to show you how to do a gentle introductory nerve floss for a group of nerves exiting the neck that congregate in this area called the brachial plexus. And then I'm going to show you how to nerve floss three main nerves in your arm: your radial nerve, your median nerve, and your ulnar nerve. If we do all four of these types of nerve flosses, we have a really good chance of reducing your neck pain, heaviness into the arm, numbness and tingling into your fingers. So let's get started. Today I want to show you brachial plexus nerve flossing. I know what you're saying, Dr. Rob, there's only videos out there on the radial nerve, the median nerve, and the ulnar nerve. But we need to also try flossing the brachial plexus, which is a network of nerves that come from the neck into the shoulder area, and then they branch out going into the arm. If we don't address the plexus as well, we might be missing the hidden origin for why you're having consistent arm pain, neck pain, shoulder pain, numbness, tingling into the fingers. So let's do this. To nerve floss your brachial plexus, you're going to make a biceps flex and you're going to show off your guns. Not that I really have any guns, but here we go anyways. To floss the plexus, you're going to open up your arm and extend your wrist back, while you're also tilting your head in the same direction. Then we're going to flex your wrist and your biceps and tilt your head away. Now we are flossing the plexus. It is moving back and forth with the motion, which should be nice and slow, 10 to 15 reps. You shouldn't have intense pain with this. If you do, discontinue. It's okay to have a little mild discomfort and fatigue, or you might even feel a slight stretching sensation. But if you do this regularly, it will help take tension off of the nerves in the brachial plexus, and it could be the solution to your arm pain and numbness and tingling in your hands. I'm going to show you how to nerve floss your radial nerve today. This is one of the three important nerves that runs down your arm. I would like you to put your arm at your side, the affected side arm. You're going to take your hand and tip it backwards. Then you're going to bring your arm back a bit and out to the side. You should start to feel a pull down the front of the arm, and as you do this, we're going to tilt your head away and bring your hand forward and then back as you cup your hand. This is the flossing aspect. Nice slow movement. We want to do 8 to 12 repetitions, take a short break and then repeat, and do this twice a day. This is going to free up the nerve movement, take pressure off of the nerve, reduce pain going down into your arm. That's nerve flossing for the radial nerve. There are 3 nerves that go down into your arms that we can floss. And today we're going to do the median nerve. To do your median nerve, you're going to rest your hand at your side. You're going to drop your shoulder down, rotate your hand out, and then bring your arm away from your body to about 30 to 45 degrees. And at this point, you should be feeling like a pull down your arm. I can feel like a tension that's happening, and I can also feel a little bit of tingling in my fingertips. You might not experience that. Some people do, some people don't. But we want to get to this position where we feel some tension in the arm. And now, to start flossing, you're going to bend your head towards the affected side, and you're going to flex your hand back, and then you're going to bring your head away and flex your hand forward. And we're just going to go back and forth. Nice, slow motion. It should take about 2 to 3 seconds to do a repetition. We're not rushing this. And you want to do about 8 to 12 reps. Take a break, and then repeat for a second set. And we are flossing the median nerve right now. If you found this helpful, comment below and let me know which nerve floss technique helped you the most. And if you want to see more videos on fixing neck pain, headache relief, posture correction, and nerve irritation, make sure to subscribe. Today I'm going to show you how to nerve floss your ulnar nerve. It runs down the outside of your arm and the outside of your hand and controls all the muscles along here. To do the flossing motion, you want to start with your hand up, and you're going to bring your hand back towards your head like you're holding the tray while you bend your head towards your hand. Make sure to keep your arm parallel to the floor the whole time. We're going to do this motion very slowly and smoothly. And as you move away, you can actually flex your hand away as your head bends away. So hand and head together, flex hand away, flex head away. Nice smooth motion, 8 to 12 reps. Take a break and then repeat for another 8 to 12 reps. Do this twice a day. It'll take 3 to 5 minutes. It'll give you tons of relief with pain down your arm and into your hand. Let's quickly address a few common mistakes that people make with nerve flossing. Number 1 is that they tend to get impatient and they'll start stretching too hard. Remember, this is supposed to be a gentle movement. Number 2, people will tend to lose focus and they'll let their technique fade. So if you're supposed to be holding your arm up parallel to the ground, as you're doing your movements, don't let your arm start to drift down. It will affect the quality of the nerve glide. Number 3 is that people get impatient and they tend to move too fast with their nerve floss. So we need to avoid quick movements like this, and we should be doing a slower nerve floss like this. So there you go. There's the 4 main nerve flossing techniques that I would like you to utilize to help with your neck pain, arm heaviness, numbness and tingling going into your hands. And remember, this is one piece of a puzzle. Your body is complicated, and generally to get the best results with your health or any symptoms or conditions you're having, you want to take a well-rounded approach. And this means that you'll probably also need to be doing some mobility exercises, strengthening exercises, postural exercises, watching your diet, eating healthy foods, keeping inflammation down in your body. This is a well-rounded game plan. Watch my other videos to see how you can protect your neck, your shoulder, your arms, your nerves. If you haven't already, consider subscribing to my channel so you can get notification when new videos are released, or if you want to find older videos that I have already produced that can help with your neck, shoulder, arm pains. As always, it's an absolute pleasure to provide these videos for you. If you have any questions at all, please just leave a comment and I'll get back to you as soon as possible. I want you to succeed and I want you to be as healthy and feel as great as possible. I'm Dr. Rob Murray with Murray Family Chiropractic in Newmarket, Ontario, Canada. I'm a corrective care chiropractor, and that is nerve flossing. Take care. I'll see you at the next video.